Nu see Workard Hello Dotor, brought to you by Workard Hospitals, enhancing quality of life.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक काळजांसावन येवकार. तुमची सगळ्यांची चवथ बरी जाली आसतलीच आनी आतां परत एकदां वैजकी मळावेल्या आमच्या तज्ञ दोतोरां कडेन वळुया आनी ही कार्यावळ सुरू करतना आज आमचे बरोबर आसात डॉक्टर आदित्य साई, गोंयचे नामनेचे हाडांचे तज्ञ दोतोर. तुमच्या हाडांच्या विशीं ज्यो कितें तक्रारी आसतल्यो त्यो तुमच्यानी आमकां फोन करून विचारूं येता आनी डॉक्टर आदित्य साईंची ही आसा वळख.
हॅलो, गुड इवनिंग.
डॉक्टर आदित्य साईन MS इन ऑर्थोपेडिक्सचे शिक्षण Sept14 मेडिकल कॉलेज आणि KEM हॉस्पिटलांतल्यान मेळयलें. तांणी फुडें फेलोशिप इन शोल्डर सर्जरी आणि नी सर्जरीचे प्रशिक्षण मेळयलां. डॉक्टर आदित्य साई हे गोंयांतले एकमेव ऑर्थोपेडिक सर्जन आसा जाणें फेलोशिप ट्रेनिंग इन मॅनेजमेंट ऑफ कॉम्प्लेक्स शोल्डर प्रॉब्लेमचे शिक्षण मेळयलां.
नमस्कार डॉक्टर.
नमस्कार.
एक गोष्ट सांगता की डॉक्टराक इंग्लीश कळटा, मराठीनूय प्रश्न विचारूं येतात, तांकां थोडीशी मराठी कळटा, पण तुमच्यान कोंकणीन प्रश्न विचारूं येता. हांव मागीर ते ट्रान्सलेट करून डॉक्टराक सांगता. आमचो नंबर तुमकां सगळ्यांक खबरच आसा, 24904444 आनी 24904445. तर प्रश्न विचारपाक तुमी तयार रावात. डॉक्टर, जस्ट टू स्टार्ट दीस शो, वॉट आय वूड लायक टू नो इज दॅट these days one of the common problems even younger age group is the frozen shoulder.
Yeah.
Because you are super specialized in shoulder and knee joint surgery as well as arthroscopy and all the procedures.
Yeah.
डॉक्टरांचे खाशेलेपण असं आसा की डॉक्टर हे म्हणजे तज्ञाकून आणि सुपर स्पेशलिस्ट आसात, स्पेशली नी जॉयंट म्हणजे धोपराची दुयेंसां आणि खाण्याची दुयेंसां हाचे विशीं. आनी म्हाका दिसता हाचो फायदो आमच्या सगळ्या पळोवप्यांनी करून घेवचो. तुमचे जे प्रश्न इवन यू कॅन टेक एज अ सेकंड ओपिनियन, कांयच हरकत ना. फक्त आमी तुमी ज्या डॉक्टराक पयलीं मेळ्ळा ताचें आमकां नांव सांगपाची गरज ना. तुमचें जें निदान आसा आनी जाचे विशीं तुमकां माहिती करून घेवपाची आसा तो प्रश्न विचारात आनी सरळ मुद्द्याचेर येयात. टायम वेस्ट करनाकात. डॉक्टर, वी आर कमिंग टू फ्रोझन शोल्डर. वॉट इज द इटियोलॉजी, हाऊ इट हॅपन्स अँड हाऊ टू मॅनेज?
See, frozen shoulder as such in the community is a condition which is commonly diagnosed.
Yeah.
But that is because we come across people who have just pain in the shoulder. You go to your physician,
Yeah.
and they say that you have frozen shoulder. Whereas as such, if you see in the cause of frozen shoulder, it is a diagnosis that you come to after excluding everything.
All other elements.
Yeah.
Okay.
So the shoulder joint is a very interesting joint if you look at it. It consists of a ball and socket like this.
Yeah.
So the ball and socket are held together by a group of muscles. Yeah. Below the muscles is a layer which is known as capsule. When the capsule shrinks, you get is frozen shoulder.
Okay. Thank you. Doctor, I'm interrupting you. We'll
Yeah,
go for
please.
management.
Sure.
Before that, we have one question. Hello, Vicharat.
Dotor.
Ah.
Good evening. I am Gunaji speaking from Kurka.
Gunaji sir, good evening. Tell me.
Yes, I am 72 years old.
Yes.
I have no pressure. I have no diabetes.
Congratulations.
Yes, thank you. Last year, I have operated in the black side hip.
Yeah.
Now I am walking comfortably. And now my knee is paining. And I am taking the Sumo painkiller tablet. So whether it is advisable to take or not?
Firstly, good evening, Mr. Gunaji.
Yes, sir. Thank you.
I'm glad to hear that after having your hip surgery you're doing well.
Yes.
Now, as far as the pain in your knee is concerned, firstly it needs there are a lot of causes of pain in the knee. It could be any of the problems in the knee. It could be a problem with the shock absorbers of the knee, or it could be a problem of the cartilage. So an assessment of what is causing his knee pain is very important.
Correct.
Having said that, arthritis of the knee in which the joint lining is eroded is a common etiology in his age.
Correct.
So that could be one thing that is causing his knee pain. Now as far as taking painkiller or Sumo for a very long period of time is not recommended generally, because painkillers are not good for kidneys. So if you take any painkillers for a short duration of time, maybe 5 days, 10 days, 14 days, maximum 3 weeks or a month, that is fine. But if you keep on taking it for more than a month's time, then what will happen is the damage to the body will start accumulating, which mainly affects the knee, the kidney as well as the gastrointestinal system.
So it is one way best for Mr. Gunaj is to take opinion of orthopedic surgeon,
Yes.
get evaluated and go for the exact cause of the pain rather than just taking self-medication. Maybe even doctor has recommended, but that is not to be taken for a long time.
Yes.
And once he establishes the cause of
Yes.
the pain, we can definitely, there are a lot of things available
Lot
and
of
people
things.
like you, dynamic young people are available now in
Thank
the
you.
state. I must congratulate that once upon a time we had very few people, and joint replacement was a very far off thing. People used to go out of state, but now it is becoming common. And people like you are making the things more systematic, more pleasant, I should
Yeah.
say, less anesthetic side effects, lesser duration of hospital stay. Doctor, can you tell us something about arthroscopy? What is arthroscopy? What are the advantages of arthroscopy over the traditional investigative procedure as well as management?
See, arthroscopy is a procedure
Yeah.
in which we take small cuts over the joint. It can be the knee, it can be the shoulder, and we put very small instruments which are, I mean, as long as this and thin as this.
Yeah.
So about 5 millimeters cut will be there in a joint. We put inside the camera, we have a look inside and see what pathology is causing the problem.
I see.
And the advantage of an arthroscopy is the time we have a look at it through a camera, the same time we can address it.
Acha.
So the advantages of arthroscopy is, the recovery time is less, the cosmetic, that is the cuts on the skin are less. And we have been treating a large number of sports people with arthroscopy and the results have been good.
Good. Okay. Thank you, doctor. Doctor, I think we are having a call. Hello.
Sure.
Hello,
Yeah.
I'm speaking from Sangolda, that falls in Bardees. In fact, you all just spoke.
Yeah, ma'am, 1 minute. Will you please reduce the sound of your TV?
Fine.
Yeah, thank you.
Yeah.
Yeah.
In fact, you all just spoke regarding about frozen shoulder
Yeah, ma'am.
in the beginning.
Yeah.
I'm having frozen shoulder. It's almost for 2 years now. I went to a physio.
Yeah.
I went to a guide. I mean, for exercise and every damn thing. I've taken calcium, but still the pain is as it is.
Yeah.
So I'm 58 years old, diabetes patient, high BP.
Oh,
That's all.
okay. And expert is here.
Yeah, hello ma'am, good evening.
Hello.
Yeah.
Hello.
You can give the answer.
Yeah, see, you told me that you are having a frozen shoulder. So as I was explaining earlier, see, the shoulder joint is surrounded by, a lot of structures, the muscles and the capsule which give the movement its dynamic range as well as stability. Now, any of the things, any of the affections of these tissues or muscles can, decrease your movement and cause pain in the shoulder. So it can be diagnosed as a frozen shoulder due to any of this, but the underlying pathology may be different. So what exactly is causing your pain? It needs to be evaluated. It can be any of the muscles, a tear in the muscles which we called as a rotator cuff tear, any problem with the tendons around. So that needs to be evaluated. Additionally, the shoulder joint, it's like any other joint in the body. With age, the cartilage or the cushion of the joint also gets eroded. So any erosion of the joint can also cause pain in the shoulder. So we need to assess exactly what is causing your pain.
Correct.
Now, as far as the treatment of frozen shoulder is concerned, provided all these structures are fine, the initial treatment of course is physiotherapy, and generally a good result is there with physiotherapy. Now, provided that physiotherapy is not working out, there are other options available. One of the options is ultrasound guided injections. So what the advantage of the ultrasound guided injections are, with the ultrasound we can visualize whatever structures are there in the shoulder. It's better with the x-rays, of course we can't, but with an ultrasound we can. And we can give the injections in the shoulder. The other option other than that is of course arthroscopy. The best advantage of arthroscopy is we get to visualize everything inside the joint. We put inside a camera and the cuts are very small.
Correct.
And immediately after the procedure you get your full movement.
Correct. So lot of things are available and the trends in the even orthopedics are changing and good doctors are there. I think she can take a opinion and get herself treated. And one more thing about I would like to just add, rather than going to many doctors, they should go to the best doctor. That is the best solution. Rather than, because people always say, I went to 10 doctors, I went to 5 physiotherapists. Just moving from one place to another is not a solution. Going to the right person, even maybe the only one doctor should give you the solution.
Yes.
And I think my Sir, we have another question. Hello?
Hello.
Yeah.
Good evening.
Very good evening.
हांव टिना उलयतां मोरगांवसून.
टीना बाय उलय, प्रश्न विचार.
मुगे मम्मी न्हू कॉस्ट्रोजॉन्ट्रिटिस ते जालो हा.
राव एक मिनिट, मातशें परत सांग.
कॉस्ट्रोजॉन्ट्रिटिस.
Costochondritis.
ते ऑन द चेस्ट पेन जाता केन्ना
Ah,
लेफ्ट आंग
ओके.
आनी केन्ना राईट आंगू जाता
Yeah.
एट रेस्टिंग स्लीपिंग पोजिशनाचेर जाता.
या
And she's been recently operated of gallbladder stone past 6 months past.
या
So what is the treatment for it?
ओके.
Yeah. Good evening. First, the treatment and everything depends upon how long the problem is there and what's her age.
करेक्ट.
Okay. So in young people, having costochondritis, is generally a self-resolving problem. So with analgesics and painkiller medicines, generally the problem comes down within a period of 2 to 3 weeks. The only problem with costochondritis is the pain continues to linger on for a longer period of time. So it becomes bearable if you take painkillers for some period of time. It will become bearable. It will just linger on. By end of 1 or 2 months, it should be fine. In older problem, it needs further investigation. So it can be she has already undergone a gallbladder surgery. So we have to consider that her body is under stress. So all latent viral infections get activated and they also cause costochondritis at times. So she probably needs a proper assessment regarding what is causing her costochondritis. Of course, initial trial of with painkillers should help her out to decrease the pain. If that is not helping her out, she will require a further assessment of what exactly is causing the pain.
ओके. म्हाका दिसता टिना बाय तुज्या प्रश्नांक जाप मेळीच आसतली. यू कॅन कन्सल्ट डॉक्टर, बऱ्याचशा दोतोराचो सल्लो घेयात आनी डेफिनेटली म्हाका दिसता थिंग्स कॅन बी मॅनेज. जशें डॉक्टरान सांगलां की थोडे दीस ती पेन मातशी उरूं शकता जर जाणटो पेशंट आसा जाल्यार, पण हातूंतल्यान कितें तरी नक्कीच मार्ग काडूं येता. दॅट इज अ रे ऑफ होप म्हणटा. डॉक्टर, नाव लेट्स गो बॅक टू लिटल अवर देश की धडकन. मोस्ट ऑफ द पीपल दीज डेज, usually younger generation, they are on the bike, they are on the laptops, they are busy with all their and food habits also I need not say. Common problems is low backache, especially among younger age group, neck pain, some people get numbness of the hands, giddiness, all these related things. So I would just put it in a summarize this as a ergonomically designed problems rather than just
lifestyle
saying,
disease.
Yeah. I think before we we'll just address this question. Hello.
Hello.
Yeah.
I'm having a knee problem.
Age.
Age 55.
Okay.
I'm taking a joint staplen and Cartisep sachet. Moment I stop that treatment, I get the pain again. Is there a solution to take that medicine for lifelong or some other problem?
Okay. Any other problem you have?
Only knee problem.
No, means are you taking some medication for diabetes?
No, I'm not diabetic.
Nothing, no other problem.
No.
What is your occupation?
I'm housewife.
Okay. Anything you want to ask?
Yeah, is pain her problem or is the knee giving way that is her problem?
I'm having knee problem.
No.
No, knee problem is what? Do you get pain? Do you get swelling? What is
Yeah. If I sit for a long time and when I get up, I can't walk properly. I just linger like.
Hello, good evening.
Good evening, doctor.
See, your knee problem can be caused by many reasons, okay? At your age, the first thing I would say is, say you told me you're 55, so the probable thing at your age that comes to my mind is early arthritis of the knee. So what happens in arthritis is, any joint in the body is lined by a smooth lining which is called the cartilage. It acts as the cushion. So like there is in a ball bearing rotates in a cycle, it allows free movement of the joint. Now with aging what happens is the lining gets destroyed, that is called arthritis.